Okay, guys, let's start out with talking about the classification of pain. So, pain can be divided in several different ways. You can divide it based off of duration, the pathophysiological reason for the pain, and severity. So, starting with duration, pain can be divided into two major durations: one, acute, which is less than 30 days of pain, and two, chronic, which is greater than 6 months of pain. Acute and chronic pain are treated somewhat differently, and we're going to talk about that more whenever we talk about some of the disease, and they both serve some different purposes. So it's a good thing to keep in mind that there is a difference between this acute and chronic pain. Next, you have the pathophysiological. So patients can have neuropathic pain or nociceptive pain. So neuropathic pain usually is associated with stinging, burning, feeling of numbness kind of pain. You can think about it almost like whenever you sit on your foot too long and your foot's asleep. It's kind of that pain. Neuropathic pain usually is chronic in nature as well, and it is treated different than nociceptive pain. Nociceptive pain is that pain that we're most familiar with, that stabbing, throbbing sort of pain. And it can be divided into two different groups as well: visceral pain, which deals with organs, and somatic pain, which deals with your muscle, bones, and joints. So visceral pain can be associated with anything from an appendicitis, needing an appendectomy, and that's causing abdominal pain, to things like a heart attack, where the patient does have ischemia that's causing the patient's pain, and thus that would be a visceral pain as well. Somatic pain, again, is kind of the general pain that we think about with muscles, bones, and joints. So you think somatic's muscles, visceral is organs. And then finally, you can divide pain by severity. You have mild pain, which usually for most facilities will say is pain from a 1 to 10 level of 1 to 3, moderate pain, which is 4 to 6, and severe pain, which is 7 to 10. A little bit more about acute versus chronic pain. So acute pain, again, is less than 30 days, and chronic pain is greater than 6 months, but their function is very different. Acute pain is adaptive in nature. Think about it this way. You hurt your ankle when you're playing volleyball, right? It hurts, and it hurts whenever you continue to try to use it. This is adaptive in nature because your body's trying to prevent you from reharming yourself or making your injury worse. This is different than chronic pain because many times in chronic pain, the healing's already happened and we're just still having pain even after the bone and the muscle has healed. And it's usually non-adaptive in nature because even though you have healing and you can't re-injure that same position or that same muscle, bone, or joint, you're still having pain. Another big difference between acute and chronic pain is whether or not you can find a cause. There's many times in patients with chronic pain that you can do a full workup and you can't find any underlying cause, no structural abnormalities, anything like that. Versus in acute pain, you almost always find a cause. Because of the chronic nature of chronic pain and also some of the psychosocial underlying effects of chronic pain, you are going to see that depression is much more common in chronic pain compared to acute pain. Unlike in chronic pain, we can sometimes cure acute pain because we can take care of whatever the underlying condition is. Versus in chronic pain, really all we're trying to do is maintain functionality. Finally, patients with acute pain are less likely to have tolerance to opioid medications, especially with their initial therapy, compared to those with chronic pain. Overall, chronic pain can be neuropathic or nociceptive, versus acute pain is usually nociceptive in nature. So that stinging, burning pain usually is more chronic. One specific type of pain that we're not going to talk about a lot today is cancer pain. So cancer pain is taken care of by a completely different set of guidelines and has a completely different set of pathophysiology and studies behind it. So this can also be called malignant pain, and it can be chronic or acute, or it can be what's called acute on chronic, where you have somebody with chronic pain that has an acute exacerbation of their pain. Now, cancer pain does affect a lot of people, and it can be caused by either the disease itself or the treatment. So if you talk about the disease itself, this is things like tumor invasion, where the tumor continues to grow and press up against your organs and cause visceral pain. And even like organic obstructions, such as your tumor gets so big that it causes obstructions to your colon. Versus, it also can be caused by treatments. So, many chemotherapeutic regimens can cause neuropathic pain and other types of pain. Radiation does tend to cause some nociceptive pain, and surgical incisions can be very painful. We will talk about surgical pain today a little bit as well. Neuropathic pain is due to lesions to the central or peripheral pathways or damage to neurons that can cause a loss of pain and sensation. Cause a loss of pain sensation, but also can increase your pain overall. Some examples of this are diabetic neuropathy and neuropathies post-herpes infections. It's usually a tingling, burning, electric shock pain, and it occurs spontaneously, sometimes without stimuli. You can have sensory deficits in this area as well. If any of you guys have taken the opportunity to do a diabetic foot exam, you'll know that patients with diabetic neuropathy often have neuropathic pain, but also will have decreased sensation in the same foot. And whenever they do the monofilament test, you'll see that they don't have all that feeling, but they can still have a lot of pain there. Patients can also have what's called allodynia, which is where you experience pain from a stimuli that isn't normally painful. Like there's patients that will say, my shirt really hurts. And hyperpathia, which is an exaggerated response to stimuli. So whenever you put your foot down, it hurts really, really bad.